Move forward with our special session of Artificial Intelligence in a Healthcare. Chairpersons are Dr. Hemant Antani. He is a senior physician at Anand. Dr. Rutvik Trivedi. He is an interventional cardiologist at Zydus Hospital, Anand. Dr. Himanshu Meghnanathi. He is an interventional cardiologist at the Tulip Hospital, Anand. Dr. Kunal Soni. He is a senior cardiac anesthesiologist at the Sri Krishna Hospital. And I would like to request Dr. Rutvik Trivedi and Dr. Himanshu Meghnanathi to introduce the speaker of the event. Thank you.
Good morning. Imagine a scenario. I just want to take you on a different world just for 2 minutes. Think about that you are just getting up in the morning, you are brushing the teeth, but you are not brushing the teeth. There are sensors in your brush which will tell you that you have this problem. Your antibody level is high, your blood pressure is different. You sit on a commode and it's a smart seat which will tell you that you have a problem today. Imagine a scenario where you think that you are sick and doctor gives you nanobots in your IV. Nanobots would circulate all over your body in the blood, will find out the cancer cells, will kill it. The appropriate drug will go and will really work on that. Imagine a scenario where you really want to go and say, well, my vision is bad. Okay, you have a choice. We can restore your vision, but do you want eagle vision? Well, we can give you eagle vision. Why just simple vision? Imagine a scenario where you actually are going with the limb which is gone. They say, we will not give you, we'll give you brand new limb. This is not a Steven Spielberg fiction, friends. This is not very far away from here. That is the artificial intelligence in medicine happening. In fact, the IBM Watson, just about 20 years back, came up with this concept. And then there was a deep mind by Google, which actually we know that it diagnosed much better than the radiologist. And then everything started, the virtual realities, and then the 3D printing, regenerative medicine, nanobots, and so on and so forth. There are so many things which are happening in silico drug trials. In fact, this is going to change the whole scenario. So exciting time is ahead, and it's always said that, whenever innovations are always exponential, while perception is linear. What we feel is not going to take some time. Friends, hold your breath. It's right here at our doorstep. And you will be surprised that your medical practice is going to change in no time. So you have to keep your mind open, and Radomix, the radiologists, are going to be using this AI the maximum. So with this very exciting field that we are having, the future of medicine, which is right knocking our doors, I think we have the best person who is going to talk about the artificial intelligence in medicine. And I have pleasure to ask my colleague, Dr. Rutvik Trivedi, to introduce today's distinguished speaker.
So, very good morning, and it's an honor. I think I work with one of the speaker, Dr. Pranav Bhai, in UN Mehta. And he had 21 years experience in the field. He's a CVTS, was a professor of cardiothoracic surgery, and took the opportunity of the admin part in the UN Mehta Institute, which is from a 200-bedded hospital now is a 1,200-bedded hospital with almost 7 to 8 cath labs, hybrid cath labs, doing all the complex interventions in cardiology, pediatric interventions, and doing great in cardiothoracic surgery department. But he thought to do something different, and leaving the subservient nature of the practice, he decided to venture in the different field. And the word we know about call is humble and arrogance, that is called as humblogrance. He is a doctor, he is an entrepreneur, so it's a doctorpreneur. So this kind of things we always imagine, but we never fail to achieve most of the time. He showed the audacity to choose a different path, and I think he's leading in the field of AI. So, welcome Pranav bhai. And I think Himanshu will speak about the second speaker.
Good morning, everyone. It's again my pleasure to introduce the other part of the Doctorpreneur startup, Dr. Amit Singh Modha. He's an ex-DRDO scientist, a former banker, an author, and a TEDx speaker. He has done multiple things in a short span of life. He did his BTech from IIT Roorkee and worked for 10 years before coming to the prestigious IIMA for MBA program with his wife and 3-year-old kid. An unusual step at his age to take, but he went on with his gut feeling. After spending 2 years at IIMA, he became a banker and re-entered the corporate world. But his urge to do something pushed him to quit the job and enter into the startup world. And he started his entrepreneurship journey in the world of healthcare, along with Dr. Pranav Sharma. He has authored a book named The Black Book, The Untold Secrets of IIMs That Nobody Told You About. He had also spoken on a TEDx platform on this topic of depression in students, and right now building a very exciting healthcare startup called the Doctorpreneur Academy, where he helps doctors establish and grow clinics and hospitals all around India. So I welcome both of you. Thank you.
Good morning, all of you. It is honor and privilege both, but I am in a difficult situation because sitting here are my teachers who have taught me in MBBS. They taught me what is medicine, what is medical life about, what is being doctor means, and now I am standing on this side and offering them the knowledge insights in the AI. So it is really difficult for me. I might fumble because I am seeing sir, then Kharod madam, and Antani sahib. Because I did my MBBS from Karam Sindh Medical College in September 97 batch. So today I am here in front of you to talk about the artificial intelligence in healthcare.
So let's start with a video which will give you a flavor of what AI is and what it can do. Hope you will enjoy it.
When we express energy in numbers, we build steam engines. When we put gravity in numbers, we build flying machines. But what will happen when we put intelligence in numbers? From playing games to creating art, these machines have truly flabbergasted us. But can they learn a talent uniquely human? Words.
In the American dream, I have a dream.
Turns out, anything that can be expressed in numbers can be learned.
So I am here in front of you, and my credentials, I had an MBBS, MS, and MCH in cardiac surgery from All India Institute of Medical Sciences, and then I did some diploma courses for medical legal and healthcare management. And with me is Dr. Amit Modha. He has done PhD in France and MBA from IIM Ahmedabad and BTech from IIT Roorkee. So together we have founded this company, and we are helping the doctors to become independent entrepreneurs. So how many people in the audience know about AI or its potential impact in the healthcare? How many of you have had the taste of AI? Please show of hands. There are significant, but not that many also. So I'll try to just give you a sneak peek into AI and how it can be used and how it can be implemented in our practice. Because Forbes magazine has just told that AI is adopted in India in the most fastest and the best way. That is why for non-medical. But I feel that in medical field also this should happen. We should take up AI as a tool which will actually change our way of practice. And you need not worry about that. It is a tool. So it will work as you tell it to do. And it will deliver results, it will give you good time, good family time, and it will give you time for your own self. So you should think in that way. How many people feel that it is another fad? It will pass away. No? It's not a fad. Initially, when the maths teachers were protesting on calculators, they used to say that calculator is dangerous, but it came. Internet collapse was predicted, but it is there. People said that it is only a passing fad. And even stethoscope. It was not accepted by the doctors initially. Eventually, it is the identity of the doctor. So it will take some time for the medical community to accept the stethoscope also. Now we can imagine a doctor without a stethoscope. So this will take a while in recognizing in a full-fledged health tool. Because right now, a lot of information about AI in the social media and internet. But actually, it will take a little while to become a full-fledged health tool, and that will happen only once we embrace it and use it, start using it.
It's a collection of our teams and efforts to bring the benefits of AI to everyone.
So this video is from the Google, who is CEO of Sundar Pichai, and he's talking about Google AI and how they are actually making the difference. Just have a look.
And we want this to work globally, so we are opening AI centers around the world. AI is going to impact many, many fields. And I want to give you a couple of examples today. Healthcare is one of the most important fields AI is going to transform. Last year, we announced our work on diabetic retinopathy, which is a leading cause of blindness, and we use deep learning to help doctors diagnose it earlier. And we've been running field trials since then at Aravind and Sankara hospitals in India, and the field trials are going really well. We are bringing expert diagnosis to places where trained doctors are scarce. It turned out, using the same retinal scans, there were things which humans quite didn't know to look for, but our AI systems offered more insights. Your same eye scan turns out holds information with which we can predict the 5-year risk of you having an adverse cardiovascular event, heart attack or strokes. So to me, the interesting thing is that more than what doctors could find in these eye scans, the machine learning systems offered newer insights. This could be the basis for a new non-invasive way to detect cardiovascular risk. And we just published the research, and we are going to be working to bring this to field trials with our partners. Another area where AI can help is to actually help doctors predict medical events. Turns out doctors have a lot of difficult decisions to make, and for them, getting advance notice, say 24 to 48 hours before a patient is likely to get very sick, has a tremendous difference in the outcome. And so we have put our machine learning systems to work. We've been working with our partners using de-identified medical records. And it turns out if you go and analyze over 100,000 data points per patient, more than any single doctor could analyze, we can actually quantitatively predict the chance of readmission 24 to 48 hours earlier than traditional methods. It gives doctors more time to act. We are publishing our paper on this later today, and we are looking forward to partnering with hospitals and medical institutions. Last year at Google I/O,
So this video actually gives you one of the capability of AI is about how it can predict the things, not only analyze. So if you see algorithms have been there for last 20 years, but how AI is different and how algorithms are different. So this video actually depicts that when the algorithms can predict the next course of action, even when human or doctors cannot analyze those things, that is one of the capabilities. So we'll show you another one video just to show that what are the capabilities of AI. Okay. So this video shows how you can have a 3-dimensional MRI where you can actually go inside and see what is happening, and that can only possible if you have that predictive ability with lot of big data analysis.
These are the details which we don't get even in an autopsy or an anatomy class. You can slit through the brain, cut the brain, see it in various parts with a lot of accuracy and result. And let me tell you, AI is like an automatic car. You will say that, okay, my gears are perfect, I want to drive my own car in a particular way. But if you will use automatic, then you will be fond of it. Similarly, AI is there. You can do your practice in a normal way, but once you embrace AI, you will find that the work is becoming so easy.
So this videos I think must have excited you. This is the kind of capability it has, potential it has. And it's not too far. It's actually in reality things are going on.
So with that brief introduction and brief videos, see where Americans are thinking that AI will help the most. And you can see first, protein structure in cells. So that predicting the protein, anything which is digital and it is repetitive can be done by AI better than by man. Because that is not an ideal use of our time. Something which is repetitive and digital. So 56% say that robots can perform the parts of surgery. 54% say that producing drought and heat resistant crops. Detecting skin cancer, 52%. And extreme weather, that is 50%. Chatbot support to mental health. See, everybody doesn't have that much time to explain everything to the patient. But then chatbot can help you. He can talk in your language, in your accent, in your tone, and that can be a kind of a face saving for you till you get time to actually talk to him. So that can be used. It is. But there are some doubts which are already there. So what are the doubts? Will it take over the healthcare professionals? Many industries will be hit. Robots will do our job. Will AI replace doctors? I don't think so. And it is not like the case. We are unique and clinical medicine is unique. But this is a tool for you. This tool can help you out doing the things that you are doing in a much faster and much correct way. Because the minimum errors are there once it is going through first, second, third rotations, and then you can get a better outcome at the end of the day with AI. So everybody is thinking that how my specialty is going to be affected. Whether the radiologist will be there or not, anesthesiologist will be there or not. That's the question which we will be answering. Before we move forward, I'll just give you an introduction. That I did my MBBS from PSMC, General Surgery from BJMC, and MCH in Cardiac Surgery from All India Institute of Medical Sciences. I was a medical administrator at UN Mehta Institute, Chief Medical Administrator, and I was the professor of cardiac surgery. When I left my job, due to some physical issues, I ventured into healthcare consultancy domain, and I founded this Dr. Pranav Academy. I'll tell you about that in a brief. And I have my friend, we met by serendipity, and he is a PhD from France, he is MBA from IIM Ahmedabad, and BTech from IIT Roorkee, and he is a scientist and banker, author and speaker, and he has been a strong force with us when we conceptualized this academy. He has worked in a lot of firms, and some are government and non-government both. So I combined with him, and we formed this Dr. Pranav Academy. And we have a vision to help the doctors and other healthcare professionals become independent entrepreneurs by telling them, giving them the system, tools, and practices, processes, and to help them grow holistically. So this is how we have grown. We are in more than 300 cities, 29 states. We have reached about 1.5 lakh doctors in 3 years, 10,000 paid community members. Through them, we are able to impact a million lives on a daily basis, and we have just started.
How many people know about us, or just your or kind of member of the academy? If there is somebody who is
how many people know about us?
Okay, so we know a little bit. People know about. Fantastic.
So we met all the stalwarts of medicine, and we have a good community which is growing day by day. And this was in Goa. We were together last year. Coming on to the topic now. What is artificial intelligence? So let us understand. It is intelligence demonstrated by machines. Machines are not intelligent by per se, but if you see that the machine has been advanced to that level that it can think now, it can copy something, or it can multiply, divide something, that is where the artificial intelligence comes. So it is the ability to acquire and apply the knowledge and skills, which is not usually expected from that. You can analyze the data, you can perform the task, you can write the songs, you can detect the pedestrian from the self-driving car. All this is AI. And what are machines? So it is not only the machines are physical machines. Machines could be software based with actuators in them, and it can be hardware based also, like a robot. So that will be fed by the information that will make them understand and derive the outcomes and predictable way they are going to function. There is a level where the predictability goes out of function also. So you have to create a barrier, and you don't have to go to that stage. Now coming on to what is machine learning. So AI works through machine learning. Machine learning gives the computer ability to learn without any explicitly programmed. For example, if you want to say to this AI tool, help me about think about a cat. So cat, we don't need to tell him that cat drinks milk, and cat has 4 legs, cat has 2 eyes. We just need to tell them what is a cat in the form of this. Once you have this, it will understand, it will take its photograph, and it will derive the image. And as soon as this photo comes up on a video, it will detect that it is a cat. Something like that. What we tend to do is that we give you a lot of information. But no, it is the prompts. It is the prompts which you give to the AI large language pathway, that what you exactly want, that it will deliver. So input is going to be the determining factor. So if garbage in, garbage out, and gold in, gold out. So we have to embrace it, because its time has come, and everybody has to embrace it. It is just like internet. You have to learn it sooner or better. It gives you an edge over other doctors when you think about your studies, your professional career, or clinical or hospital work. And once you dip into this, you will enjoy it. So some medical use cases we will discuss.
Yeah. So first medical use that we want to highlight is the speed in analysis. Okay, so when we say speed in analysis means AI can diagnose heart disease or any other disease much larger, much speeder in their reports. If the content is in digital format, and it is very important that all reports and everything is in a digital format, then it means that AI can learn, just like an cat example which we have shown. So it compared to like what a doctor or 100 doctors can do, a machine can do in 30 minutes. So that is the speed in analysis which cannot be matched by human. Second use case, this is a quantity in analysis. Okay, so when we say quantity in analysis means radiology AI can interpret 420 images in 90 seconds. Now it cannot be possible for a human to do that. And since if you see that radiology is the far most digital streams of all the healthcare domain, and hence radiology will be the first one which will be getting impacted. And when we see impacted, it doesn't mean it is a fear. Okay, there is a This is actually enhancing the productivity. It actually helps. Third is the complexity analysis. Now, what 100 researchers or junior researchers can come together, do a research paper in 6 months. Now it can be done by a computer model with the predictive analysis and AI algorithms. Okay, so AI can do complex research which like humanly it is impossible, and it can see the interaction which nobody has seen. So those kind of data set with large amount of data, and they can see what we cannot see because they have this ability of learning and then self giving you the answers which you have never thought about. So that amount of complexity, it is humanly, it is impossible to do that kind of research. Then the public health. Okay, public health, it will be widely used, and it was used in the COVID time. So during the COVID-19 pandemic, it was first actually reported by, actually nobody knows much about that, but it was reported by Canadian company called Blue Dot, which has access to airline data and public health data, and it predicted the outbreak 5 days earlier to the WHO. Okay, so they took the airline, the behavior of people running away from the outbreak or some kind of disease to some places, and they took the data of public health and they match, and they saw that there is an outbreak going to happen, and that is 5 days before actually it was announced by WHO. Then finding the unusual associations. Okay, very unusual associations which we can't even think of. Okay, so all these are examples of like brain waves, an PET scans detects Alzheimer's, all those things which cannot be actually we thought about, they can actually analyze, because I can fed or I can feed 100 of research paper of one stream and 100 of unrelated stream and find the correlation, and they will give you the examples whether this is relevant or not. So people can, one researcher can do day in day out research and find the relevant thing. Live subjects for clinical trials will be like, it will be foregone in maybe 5 to 10 years, because everything can be done on the computer business model, AI model. Making the life of critical care of people here sitting better, because then on the average there are 200 alarm signal per bed, and there are false alarm and people have to run through. 70-90% are false, so there are a lot of alarm fatigue, and especially if you see the Western countries where there are shortage of clinical people, it is actually a very helpful tool. May decrease the unwanted signals by 99%, and there are a lot of other tools which we'll discuss specific to critical care where they are actually getting help. Then almost everything operational can be automated. So if you are running any of thing manual, then you are doing actually wrong. These all things can be actually done with AI and automation right now possible. Okay, it is whether it is billing, administration, appointment, automated call, data analysis, logistics, everything can be automated. Whatever is repeated and digital, that can be automated using right now automations and AI tools. So if you are using manual people, tasks, errors, actually you are doing the right or wrong way, you will do it in 5 years if you don't embrace it. If you embrace it now, you can actually increase your productivity. So what is the impact of different specialization? A lot of people talk about, and they are actually very worried about that. And so this is a very in AI, this is the very well known 2 by 2 matrix. In the x-axis, it says something that happens, means how creative a branch is, okay, and how repetitive in the y-axis. Okay, so if this in x-axis, it is how creative is, means how manual intervention is required. When it is like for example homeopathy or Ayurvedic, where a lot of counseling happens, or maybe psychologist or psychiatrist, where a lot of counseling is needed. So more creative is x-axis, and y-axis like how much repetitive task is there. And if you see the whole spread right now, here is what you are. Yeah. So this is here. Right? So this is so less of repetitive and more of creative, right? So here you are right now. Yeah. So that means we here are not in that much of danger. If you are here in this space, that means radiology is like most, if very very easy to replace. Okay, so radiology will be quite fast. It will be impacted, and then if you see you are going here, which is like on a safer zone, but then AI will help you as a tool, productivity. What 10 people right now can do, critical care expert, 1 people can be doing in the sitting in the control room. With right now we have a solutions where tele ICU and a smart ICU are going on, right? So these are more about giving you a overall grandeur picture that how things are going to be impacted and how things will be going forward. So it is not to get afraid, but to see the trend which is going forward and start making correction.
There is another way of looking at this photograph also. It is that if you are doing more repetitive tasks and which is not having a lot of interactions or then there is a great opportunity that you should learn AI fast.
Right.
If that is impacting your branch, you take it as a challenge, understand it, start using it, so you'll get an edge over others. So in critical patient management, you can say, see, you can recognize the disease. That is a clinician's job. But if you add AI, it will be faster. It can give you complex decision making? No. Can it give you disease progression? Yes. And you can recognize the unique pattern in the complex data. Challenges about AI in critical care patient management. So, you can interpret the data, yes. It will decrease the clinical readiness, AI. In privacy and sharing, yes, a role. And suboptimal adherence to standards, no. So this AI innovation is happening in the critical care all around the globe. You can see the companies which are coming up in a big way.
So these are just snapshot of only 5 startups. There are almost 500 startups who globally in India also, even in Ahmedabad or Gujarat based, there are a lot of people who are doing. These are just top 5 people who are doing fantastic work.
For example, Clinomic, it has created a bedside AI for critical care. You can go and search on these companies in the internet, and they are doing a fantastic job. But I'm not sharing each website or promotion of any of these. But you can see and understand in which direction you should be going. Respinar has developed a diaphragmatic monitoring device. We will share this presentation with each one of you.
Yep.
So don't worry.
Yeah, but you can take the screenshot.
Yeah. The Cohere enables the sepsis detection. Omnicure is a company which has created a telecritical care solution. And Cloud Physician, it has developed a smart intensive care unit.
So all this, if you see, a lot of these startups are actually a kind of tool. They are helping the critical care expert to be in ICU, or whether you have 10 bedded ICU running and there are no smart people, or there are no clinical expert. There is still one person can actually do what 5 people can do in right now. So they are increasing the productivity. That means you have to increase broaden your space of working and go to the more innovative way of helping the patients.
The way I will want to put it is that after this talk is over, whenever you go home in the evening, go to the internet and search your branch in AI. AI in critical care, AI in medicine, AI in pharmacy, AI in radiology, and you'll get a lot of things. Start using Bard or Gemini, start using the Chat GPT, and you will see the things that you have never imagined. It can give you things like how many CCTV are required in a hospital. It will give the answer. It will give the areas and it will give you the answers. It will give you a good suggestion. And if that suggestion, you talk to a person who is a CCTV vendor, he will be blown away. When you will say that I want 25 CCTVs of this company, this amount of money and this much warranty, he will be flabbergasted. He will think, kahan se sikh ke aa gaye aap log? Right? So that way we have to be a little smarter.
Even we have not talked about ChatGPT and other kind of bot. There are a lot of bots who are kind of launched in the market. Like because of paucity of time, we have not touched about. But ChatGPT and others, Gemini, and there are Perplexity. A lot of AI chatbots are there, which you can actually, in going forward, what I see, if you are there, you have 2 or 3, you are a big doctor and you don't have a time, you have 3 or 4 doctors, junior doctors who are taking help, who are taking the reports and finally giving you a conclusion. Right now, that is how things are going on. Imagine if you have a machine who are giving you in that 5 junior doctors work to you in much more conclusive way. So that is how things are going forward. And then after seeing the report, after giving the prescription, you can actually send a voice message thanking the patient with the report, how to take a medicine in your voice, in your avatar. Okay, so you can create like thousands of your own avatar in your voice, and one person, technical person, need to put in the English words that what you want to say and send it across or to WhatsApp. So you are speaking in your language, in your accent, in your way, and you are not even aware that how many patients you are seeing in a day. So that is how things are going to happen in future, how your operational things will be.
In fact,
done.
in ChatGPT, you can also talk in your vernacular language. So if you want to create a patient information guide, you can put that prompt into that, and prompt will give you in Gujarati also. The whole thing which you try to explain or try to detail the patient, you can take it in any language, it will be converting it to you. And that is also useful for any information sharing you want to do. You want to do your branding, not advertising, branding. So if you want to do that, you can create videos out of the content which is generated by ChatGPT, and you can easily convert it into faceless videos or animated videos. That will go a long way in creating your brand. So will AI is going to replace the doctor? Doctors will not be replaced. But those who do not learn AI will be replaced by the people who are knowing it.
So that is going to happen. So it is. A lot of people ask us how AI is going to impact our specialization. So we'll give you a little bit of a little bit of structure that there are two kinds of AI tools. One is your clinical specific, which like your people in your domain, Google, Amazon, and all those big data companies are also giving you as a tool to enhance your productivity. And then there are productivity enhancement tools, which means like social media tools, operational tool, HR tool, lot of other tools which can increase your productivity. Right now, how you leverage human resource to increase your productivity, you will be using technology to leverage, you will be using technology to increase your productivity. And that means like time is money. Increase productivity means increase flow of money or increase service to the society.
So basically, all that is important is the prompt. The way you put a prompt in a ChatGPT, if you just say that, give me a detail for diabetic foot, and another is way that you are a podiatrician, you have a patient in your OPD, he has some foot problems, guide me about the things that I have to see and what questions I should ask. It will give you exactly the questions what you should asking, and without fail, it will give you a better outcome. So it is very important to put a correct prompt.
And also just to give you a disclaimer that ChatGPT itself says that it is not a replacement of doctor. So whatever data is fed is from the internet and other different sources. So when you are using any chatbot, internet presented chatbots, you need to use it as a guide. Okay, maybe you might have missed one parameter which it has now pointing to. So you can just look as your unpaid junior doctor who can give you a lot of results with all the research and give you the best of the answers, and then you can see what is the right. So you cannot take the ChatGPT output as a gospel truth that this is how it is to be, but it can always give you a better or one more option.
What I usually compare is this large language model is like a genie. It will immediately come in front of you and say, "Kya hukm hai mere aaka?" And then if you give them acha hukm, then it will do the things. Otherwise, if he is sitting ideal and you are not feeding properly, it will create things on its own. So basically, use it wisely and take the advantage of this.
And even there is one more use case is that a lot of people have written papers here, a lot of dignitaries have. You can actually take maybe 10 paper here, 10 paper here, and put in a AI system. There are tools, scientific research tools right now available, and you can get their summaries, and then you can find intercorrelation between whatever parameter you are thinking of, 10 parameters, and you will be blown by what comes out. No, you never know. So you can actually write a research paper by analyzing those 10 papers. So
in fact, something which you do not like in the training is the analysis of the data, and compare the things and creating a paper out of it, or maybe a presentation research article out of it. It can do all the information research. It can study all the PDFs. It can study all the numericals, and then it will give you the brief. From there, the starting point you can get.
So one more video just to end this presentation. Is it available?
Open Samantha Johnson's report.
Please select from the following complete reports found for Samantha Johnson.
Can you confirm her probable BRCA2 germline mutation?
Not future, this is already happening. This is already going on in Western.
That's from my side.
So we want to thank you, and if you want to join our AI workshop, because there are a lot of things that we cannot cover here, you can scan and register for the next workshop, and we are now open to the questions if you have any. Thank you so much.
Thank you.
If I'm allowed, I just want to give, there are so many youngsters here. Can anybody tell me what are the top 5 causes of the death in the world? Okay, one of them, most important 5th cause in the world, anybody knows? That's iatrogenic. And in fact, it's not negligence, honestly. It's a part of the medicine. So if you look at the larger picture of artificial intelligence in medicine, it's a precision medicine. Because you are actually creating a very personalized care for the patients. So 2 things I want to say here, which are already very much in vogue today. And I think many people are using. One is 3D printer. In fact, it has got a lot of value in this organ transplantation.
Yes.
And in fact, the valves. And one of my friend in Anand, a dentist, is using a 3D printer for his, tooth implants. So it's going to be very, very accurate, and that will really obviate so many problems which are happening. One more thing which is already happening, it's already there in Mumbai, it's already there in USA, one of my relatives is doing it. It's called as a pharmacogenomics and nutrogenomics. What you just have to do is just give saliva, and they come up with all your genomes, and they will let you know which drugs are going to be good for you and which drugs are going to create problem. Same way, which nutrition is good for you, with which you are going to put on weight, with which drug, food we are not going to put on weight. So many things are happening, and this is in the larger picture. But at the same time, hacking of the website And so many other problems also would come with AI. I'm sure you also would appreciate that. And the last thing, if you really want to write down, all the youngsters, I'm giving you a name of the book. All of you must read this book and everything will be clear. The author of that book is called Eric Topol, Erictopol, Eric Topol, and the name of the book is Deep Medicine. I'll repeat, Deep Medicine. Every doctor must read this book. It will tell you what next 20 years are going to be and how you can be a part of it by adopting AI. Thank you very much for a wonderful presentation.
Thank you, sir. Thank you so much of this. Actually, what you have said is actually going to happen. How from a generic we are going to a personalized and very very precision medicine.
Amit bhai, I think you are an IITian here, and we have all learned mathematics. So mathematics, there are 5 constant, real numbers, rational numbers, irrational numbers. I think the graph I liked a lot is that we know E is a Euler's number, I is a root of minus 1.
Yeah.
Pi we all know, then comes 0 and then comes 1. So what you show at the end, what I feel in medicine is Euler's constant is e raised to I pi is equal to minus 1. Minus I means V. I means B, or we can say intelligence, so artificial intelligence. 0 somewhere comes a God. 1 comes a patience. Then comes a learning. And the last part comes are the constants. Now constant is a time constant, I would say. Now whatever usage you have shown, I think I am very much into this field, and recently I had been to one of my field of cardiology where the artificial intelligence people were working. I think US is far ahead of that. So what they defined artificial intelligence. So what we generally feel intelligence is a problem solving capacity. So we always look intelligence part as a problem solving capacity, but we forget the EQ part, that is the emotional quotient part. And there are a lot of factors which are playing. So personalized to a doctor versus a patient. So one of the trials which we nowadays are into that is a TAVI. So TAVI is a transcatheter valve implantation. So from 2016, I think they were using AI predicted model, and they generated a specific design that this patient will be suitable for this balloon implantable or a self-expandable valves. So everything was very much predefined. So in 2024, which problem they are facing is a degeneration of valve, which they have not predicted. Because at that time in 2016, when they were initiating the trial, the data they have based on that model, they have given a right advice. But that right advice now creating a trouble, because in 2024, they have to again do, because surgery was declined, saying that patient was very high risk. Now they land up in a trouble because already there is one valve, and that valve implanted percutaneously, and that making a trouble. So now they are sending them to a surgeon. So there is one more paper, I think CVTS surgeon is here, he'll point on that part, that now surgeons are opening the previously high risk surgically declined patient for TAVR because the valve is degenerated. So the point is different. Point is not it is a friend or foe or a frenemy, whatever you say. I think it is a friend. So everybody should accept this, that the last corner part where there are a lot of people who will not learn, they will face a problem. So technician's job becomes much more easier. But the clinical making part, so teachers must be knowing that at the end when we used to present a case, so clinical history, then there was a differential. So from history you have to make a diagnosis. That from history, I feel 1, 2, 3, 4 diagnosis. So that becomes a machine learning. So you give history to the machine, he'll put a same 4. Then comes the clinical examination part. Then your differentials will change, the sequence will change. And then comes the investigation. So exactly that point they have taken as a machine learning part. But the machine learning also involves art of history taking. That is not there. So that part is always going to be with the clinicians. But the learning is always persistent. I think that part one should always accept. So, but these are the flaws. And I think they are also working on the correction of that. So e raised to I pi always remains -1. So e raised to I pi plus 1 becomes a 0. So at the end, the complete results needs your involvement, machine involvement, constants God itself and the patient.
Absolutely.
I think one more thing is कि AI, like we think that it is a newer thing, but we have been using it for a quite long time now. But he was not a good student basically, so we don't used to believe that ECG used to be taken, and there are written reports on the ECG by machine showing anti-oval ischemia, LV hypertrophy, but we don't even stare at it because he is not a good student. But now AI is improving. They are going to say, and you would not be able to defy that order that it is what I am saying. So I think it is just improving and improving, and it is becoming a better and better student.
Yes.
And I think we need to be
Yes.
ready to accept as a teacher downstream.
True. That's fantastic. Valid points, both of them. And I just want to add that AI is just in infancy. It's still not born. If you see if analogy of a kid, a child born is still in first trimester, and it is growing by leaps and bounds. So what you feel that it will come in 20 years, it might come in 5 years. What you feel in 50 years, it might come in 15 years. So still it is just started. And why we are talking about AI in healthcare specifically right now, maybe 10 years after many industries, is because right now there are tipping points of lot of technologies coming together. Like sir has said, 3D printing. Now 3D printing once upon a time is not related to any kind of AI, but now we can connect it to. So 3D printing, AI, big data, healthcare. That is why if you see the Amazon, Google, Microsoft, all tech companies actually becoming a healthcare company. Yeah. Why it is? Because it's a data-driven world now, and they have lots of data. And so when the machine start learning, and by itself start generating results, and it is still like what I say is first trimester, when it comes out as a kid and maybe 5 years old, you will be blown by what the capabilities could be.
We'll just give you a demonstration of a tool, ChatGPT, and we will show how prompts can make a difference.
So how many people have used actually ChatGPT for some purpose? Yes, fantastic. So yeah.
Right. So if you have written that you are a cardiologist and gave me 1 week social media calendar.
So how do you, I just give you a brief description how we write this prompts. The commands to give to the slave is called prompts in AI world. Okay, so prompts are like, if you see the simple formula, take it as RTF rule. Okay, role, what you task you want, and in which format you want the answer. So very easy. There are a lot of complex structures, but if you see from the starting, RTF is what you need to follow: role, task, and format. So give it as a role, what is the task, and how do you want data to be represented.
So we'll do this exercise in such a way that you give us the prompts, what do you want, and we'll write it, how to write it, and how to get the best output.
Okay, so this is an example for like social media, because everyone has to be there in social media whether you like or not. So I just giving you examples. So when you say role, you say that imagine yourself as an expert. So we will say you're an expert or experience. Screen is visible or not? Yes. So still there, yeah? So imagine yourself an expert cardiologist. So now this is the role which you have given. Now task, give me a 1 week social media calendar. If you want to be more specific, for platforms like YouTube, Facebook, maybe LinkedIn, maybe Instagram. Okay, so this is the you have given, and you ask them, give me short format. Okay, so it could be a long format or short. So give me short format content.
This ChatGPT 3.5 is absolutely free. Anybody can use it. There are no charges for that. And see the magic.
So day 1, YouTube, understanding heart palpitations. Day 2, Facebook, did you stress? I cannot read it so fast.
सोचने के लिए भी we will take a day. Plan this thing.
नहीं करने क्या
और
सर?
आप उस level पे जाओगे, which is not repetitive and not documented.
So that means we give you an instrument which is run by this.
No.
It is the medical input, the feeling from the gut or your experience. It cannot be replaced.
But for the feeling of the gut and the intelligence, because it gives information, the knowledge and the interpretation come in a people which have a train from a residency days. If this is replace the book and clinical teaching which we got from our professor, so I cannot imagine what it will be a future, because even a COVID, when the patient comes, when we say even a TB patient, we say this is a reform patient, and they say sir iska side effect kya hoga, they immediately Google it and ask the questions. Now it's become a trust factor. As sir says, in the TAVI, when the TAVI come, most of the people replace. My friend is doing a TAVI, right? After 10 years, they had a problem, which was designed for the surgery, high risk. Now they have to convert. So there is a lots of, again, explain to the patient. It's really you require the extraordinary people, extraordinary doctor who judge, predict the future complication of the device or for the treatment and the counseling the patient. So I think it will give you easy for all the the pathway. But to interact with the patient, I think it's going to be a very much difficult task, and we need to prepare for that. And this is the thing, same thing. Who is extra intelligent or intelligent, who is below average, the AI will make the same level.
So it is right point, but the assumptions you have taken and upon which all question is based is that this is going to replace doctor. That is not true. Doctor will not be replaced.
But like see the radiology, when the COVID comes, there the COVID scoring system is come, right? I had one wife of the High Court judge. She had a tumor in the bronchus, which was the miss in the COVID time, because COVID time that AI just giving us scoring 14 after 25 like that. And then after 2 years, she came to 2022. I asked for the previous CT and I found out there is a tumor. Okay, so that is that issue. If AI come, it will replace most of the technical job, right? But the some branch, the radiology, the pathology, microbiology, right? Even in clinical parameters like ChatGPT, you write the symptoms, right? You write an investigation, they give a diagnosis. And after sometimes he will give a treatment also. And the treatment, you have a online pharmacies or over-the-counter medicine. The people get and take a treatment, okay? I'm not worrying about my job or the future job, but what's the impact in the society? What could be a scenario and the doctor-patient relationship and a medical-legal case?
Okay. I'll tell you. See, it has arrived. So there is no if or but about that. The technology is there. Now you have to decide how we are going to use it. We can use it at our advantage also, and you can just leave it. So it is better to use it for our advantage and improve your clinical practice by embracing it. You can do a lot of things like how to explain the patient about diabetes. If there are 10 points you want to tell, you will take a lot of time to actually generate those points on your own. So it can be generated by this. And even, for example, if you are wanting to explain him about some disease, you can get the whole data from here and they can explain. So it is a tool. You should use it like a tool.
Thank you. I think I would request everybody to have one-to-one chat. Okay, last question. And if anybody has a query, they can have one-to-one chat at the time of lunch.
Yeah.
Thank you.
I think for medical practice, there is no question. This is going to be in thing or it is already.
Right.
But for medical education, you see, now what do we teach our students?
Right.
There are 3 components for anything: what to do, how to do, and why to do.
Yeah.
Now, so far, all our energy was consumed in what to do and how to do. Say 1% inspiration, 99% perspiration. Now, rest of the things are going to be taken by AI. So the question is that what or why component, the aim of education, the aim of that, it is in a way unused or not fully employed faculty, but that I think we must, that is human.
Yeah, ma'am, sir.
Sir, I'll just comment.
Yeah.
Sir, I have always been inspired by you because you used to take away your shoes when you are seeing the patient. So that level of integrity and that level of respect, that cannot come with AI. That comes with a human only. You need to have a human touch, and that will always remain, no matter what.
And sir, I just want to add that.
I think this is the last 30 seconds. We have to end the
Yes,
session.
sir. Just to add, very good point, sir has said. So you let the AI teach your students what and why and where, how to education. You teach empathy and ethics. Just teach 4 years of empathy and ethics. They will become a good doctors. Because if everything has been taken by AI, then you teach ethics and empathy. That is what is needed in the real doctors, and that can only be given by human and doctors like you. So that will be like the right use of your knowledge.
Thank you for giving us the opportunity.
Yeah.
And thank you all.
Thank you so much. Thank you.
Thank you.
Thank you, sir.